Step therapy means it's really a cost-saving method for insurance. Insurance companies want to sort of start patients out on therapies and treatments that cost the least amount of money before they'll go to paying for more expensive treatments. Doctors will typically start out patients, kind of at the bottom line treatments and move up from there, and that's exactly what was done with me. In 2012, I had a very sudden, severe onset of what turned out to be rheumatoid arthritis, although we didn't know that at the time. I was hospitalized with heart failure and multi-organ system failure. At the same time, my then 16-year-old son, who was experiencing some health issues of his own, was diagnosed with a very rare genetic immunodeficiency disorder. And this disorder was dominant in nature, so his physicians knew that he got it from one of his parents, most likely me, given my history. So I was tested for the same genetic disorder and tested positive as well. So now we knew that we weren't just dealing with just regular old rheumatoid arthritis, but that it was actually secondary to a severe genetic immunodeficiency disorder. The good news in all of this is that there's a promising treatment for that immunodeficiency disorder, which happened to be a biologic that's commonly used to treat rheumatoid arthritis, and it was a biologic that I had never been on before. Here I was with a brand new diagnosis, with a potential new treatment, and I was failing the treatment that I was on anyway, so it really made sense to switch me right to that new treatment. But that's when I started to encounter problems with insurance. When I got the denial for the treatment, and I contacted my doctor right away, I could sense her frustration and her anger as well. She felt that the quickest way for me to get treatment was actually to sort of play the insurance company game by going through the step and fail process. Unfortunately, the insurance company doesn't play fair. And so when we did that and I played their game, then they changed the rules. So when I tried the 2 drugs that they dictated that I try, and I failed them both, my doctor documented that failure and tried to get me the drug that I needed. The insurance company came back and said, well, we changed our criteria. Now we want you to try these next 2 drugs. I guess what's frustrating for patients like me is that, when we see that there's a treatment out there that has real potential to improve my life, my son's life, but we're not able to access that treatment, it's so frustrating, and when it's because of an insurance company that's sort of dictating, what I can have and what I can't have, that goes directly against what my physician is wanting me to have. I think first and foremost, there needs to be more awareness of what step therapy is, and what it entails and what it requires patients and physicians to go through. By raising awareness, it would help patients in particular sort of know what to look for and know that maybe they shouldn't sit back and accept the practices that the insurance companies are dictating to them.